Hi, everyone. If I were the healthcare facility threat assessment and management team lead, my first priority would be to slow the situation down rather than immediately assume Knox is becoming violent. One point that really stood out to me from this week's lecture was that yelling, pacing, and using profanity does not automatically mean someone is dangerous. Those behaviors tell us to pay attention, gather more information, and understand what is driving the behavior instead of immediately labeling the person as a threat. This is important because reacting too quickly based on emotion or assumption can escalate the situation and interfere with providing appropriate medical care. Knox has several factors that increase concern. They recently used methamphetamine, reported severe pain, have a documented history of assaulting faculty and staff, are refusing to put down their backpack, and are becoming increasingly agitated in a crowded emergency department. Rather than focusing on any single behavior, I would look at the totality of the circumstances. Threat assessment is about identifying concerning behaviors early, understanding what is driving them, assessing the likelihood of violence, and developing strategies to reduce risk while providing appropriate care. Looking at the whole picture is important because no single behavior tells us whether someone will become violent, but several factors put together can help us make a more informed choice. Although my integrated safety response team was originally designed for the DCFS and DMH workplace, I think the same multidisciplinary principles apply in healthcare. Instead of working independently, I would immediately activate a collaborative response. Medical staff would evaluate Knox's medical condition and pain since their symptoms could be contributing to their agitation. Mental health clinicians would assess for intoxication, emotional dysregulation, and any suicidal or homicidal ideation. Security would remain nearby to maintain safety but would avoid escalating the situation unless absolutely necessary. Leadership would coordinate communication, and if legal concerns arose, legal consultation could help ensure compliance with patient rights while protecting staff. This collaborative approach is important because no one discipline has all of the information or expertise needed to safely manage a complex situation like this. Each team member contributes to a different perspective, leading to better decision making. One thing I appreciate about our ISRT model is that everyone has a different role. Just like this week's lecture discussed, security does not have the same expertise as physicians or mental health providers, so collaboration becomes essential. No single discipline should make a choice in isolation. Working together also reduces communication errors and helps ensure the safety for both patients can remain as the main priority. While one team member engages Knox using calm, trauma-informed communication, I would also focus on protecting everyone else in the emergency department. I would move nearby patients and visitors away from the immediate area if possible, assign staff to monitor the waiting room, and make sure employees know who is communicating with Knox so that there are not multiple people giving conflicting directions. These steps are important because they reduce opportunity for escalation, minimize panic among others in the emergency department, and create a safer environment while Knox is receiving care. If Knox becomes physically aggressive or attempted to access a weapon inside the backpack, security and law enforcement would intervene immediately. However, I would not automatically demand that they surrender the backpack without first assessing whether doing so would unnecessarily escalate the situation. The goal is to balance safety with de escalation rather than creating additional conflict through unnecessary confrontation. Our ISRT case investigation form would also be useful here. Based on the information provided, I would document Knox's history of violence, current emotional dysregulation, substance use, previous assault on staff, and refusal to comply with the request. Because there is no evidence that Knox has made direct threats or displayed a weapon, I would likely classify the situation as high risk, but not necessarily as imminent, while continuing to reassess as new information becomes available. And it's important to remember that threat assessment is dynamic, so the risk level can change as additional information emerges. Continuously reassessing risk is important because situations like this can improve or deteriorate quickly, and our management strategies need to change accordingly. Healthcare settings also present unique legal and ethical challenges. Unlike many workplaces, hospitals have an ethical and legal obligation to provide emergency medical care, even when patients are aggressive or intoxicated. That means that the goal is not simply removing a difficult person away from the environment. Instead, the challenge is balancing patient care with the safety of employees, other patients, and visitors. We also have to respect Knox's identity by consistently using their correct pronouns and avoiding discrimination based on homelessness, substance use, or gender identity. Confidentiality must also be maintained under HIPAA while still allowing information sharing on a need-to-know basis to protect staff and patients. These legal and ethical responsibilities are important because healthcare providers must protect patients' rights while also maintaining a safe environment for everyone in the facility. Overall, I think this scenario really highlights that threat assessment is not about reacting emotionally to someone's behavior. It's about slowing down, gathering information, understanding why the behavior is occurring, collaborating across disciplines, and creating management strategies that reduce the likelihood of violence while still providing compassionate, appropriate healthcare. By taking these steps, I'm not only protecting staff, patient, visitors, and the community, but I am also increasing the likelihood that Knox receives the medical care they need in the safest way possible. That multidisciplinary approach is exactly what our integrated safety response team is designed to accomplish, even though it originated in a child welfare and behavioral health care setting. Thank you.